Hi, I'm Dr. Al Hicks, a fellowship-trained spine surgeon here at Orthopedic Associates of Middletown. My training has taken me pretty much all over the country and all over the world. I started my graduate school at Georgetown University. I did my medical school at Midwestern University in Chicago. I then went to New York and trained in my residency. I did my fellowship in Louisville, Kentucky at the Leatherman Spine Center. Then I went to the United States Navy, did active duty service for 4 years, Afghanistan for 6 months. And then I started my practice once I left. Work I do in a typical day consists of seeing mostly adult patients, but also kids. And the task of the day is to find what the cause of their pain is, both in their lumbar spine and cervical spine, and then tailoring the treatment that will best get them feeling better. There is a slight difference between the orthopedic approach and the neurosurgical approach to treating the spine, both in the cervical spine and lumbar spine. I have training that was with both neurosurgeons and orthopedic spine surgeons, so I can bring both of those approaches to the patients here at Middletown. Some of the challenges that I deal with in treating cervical spine or lumbar spine issues are that some patients have had symptoms for quite some time, and they've tried some treatments, some have worked, some have not. So the challenge is to try and find the right treatments for the injuries that they have. At Orthopedic Associates of Middletown, not only am I here as a spine surgeon, but we have a physiatrist on staff whose specialty is treating non-operative spine pain, neck pain, back pain. And so at some point I might say, I don't think you need surgery, and I would then have you evaluated by our physiatrist who has other techniques and treatments that might benefit you without having to have surgery. I think that this practice is different from the others in that it is well established. Dr. Klygian established it many years ago with the idea of making sure patients were taken care of from the beginning to the end. The men that I joined and the women that I joined here hold that to heart still, and if I see a patient that might not have a neck problem, but it's actually a shoulder problem, I go right to the colleagues that I have, and we make sure the patient's taken care of. Fostering good relationships with patients starts with actually listening to their problem. I was told by one of my mentors that all you needed to do is listen, and eventually they'll tell you what their problem is, what makes them feel better, what makes them hurt. And in doing so, you can formulate a treatment plan that will get them on the road to recovery.